I am Linda van Tilburg for National Security News. A dangerous new strain of MPOX is spreading in the Democratic Republic of the Congo, with fears that it could spread further afield. And who better to have than Dr. Rosamund Lewis, the technical lead at the World Health Organization, in the studio to discuss that with us. Dr. Lewis, thanks so much for joining us.
Very welcome, Linda. Hello.
So, how dangerous is this strain of monkeypox? How concerned are you of MPOX? We should call it. Let me just rephrase that. We should not call it that.
Well, it does depend if you're talking about the illness, which is MPOX, or the virus, which is still the monkeypox virus. They just have slightly different names. We're talking about the Democratic Republic of the Congo, where there are two distinct outbreaks happening at the same time. One is in the traditional endemic areas where there are many, many more cases being reported than in the past. Those mostly affect children, and the risk is high for them because a much greater proportion of children will succumb to severe illness and can also die much more easily from MPOX than adults. So we have that situation in the endemic parts of the country. What you're referring to is a new strain of monkeypox virus, which has been found in eastern part of the country, in a province called South Kivu, and also in a province now called North Kivu. So that is still clade 1 of the monkeypox virus, and it is spreading in the eastern part of the country, that new strain, as well as in the endemic part of the country. It's kind of the original clade 1 strain. Sorry if that's confusing. I can say it again.
No, I think we understand that there's two strains of it. So could it cross international borders?
Yes, of course. We've seen in the global outbreak that the clade 2 virus reached 117 countries already in the last 2 years. So there's no reason to think that this other clade or this new strain can't also similarly spread. At the moment, it is contained in the Democratic Republic of the Congo. However, in the East, this new strain is spreading exclusively from person to person. What is typically known as a zoonotic disease, MPOX is a zoonotic disease because it originates in the animal kingdom. Small mammals carry the virus and then transmit to humans through different modes. But then there's secondary transmission. So outbreaks in human populations include all age groups, and they can also contaminate environments such as beds, bed sheets, towels, things like that in the home. It's an illness that transmits through very close contact. So that contact can be direct physical contact, person to person. It can be children sharing a bed, for example, and it could be also sexual contact, as we're seeing now in the eastern part of the country, as well as what we saw globally in 2022, 2023, and including right now, we still have a global outbreak ongoing of the clade 2 virus. So it is indeed a complex epidemiology. We have the global outbreak of clade 2 monkeypox virus, which is ongoing today. 2 years later, we still have 26 countries reporting just last month. Hundreds of confirmed cases, over 600 confirmed cases globally. And now South Africa is again experiencing that global outbreak. Then in the Democratic Republic of the Congo, we have two distinct situations. One is the traditionally endemic area where clade 1 continues to affect mostly children. And then in the eastern part of the country, clade 1b, this new strain, which is again behaving similarly to the strain we saw in the global outbreak. We continue to see in the global outbreak, transmitting through person-to-person transmission exclusively.
So it's totally different than the HIV virus that is sexually transmitted.
So the monkeypox virus is now recognized to be sexually transmissible as well. What we cannot directly and clearly determine is how much of the transmission is simply from skin-to-skin contact, face-to-face contact with aerosols. Well, basically, you could have lesions, virus in your mouth, and so when you're talking, that virus can also come from your mouth. If you're in very close contact with someone, you can also share the virus that way. You can share it through bedding sheets, needles, as I've mentioned, and virus can be shared through sexual contact, which, because it's mucosal contact, it transmits easily that way as well. So we've seen now that sexual transmission is very efficient, what we call efficient, for this virus. And therefore, it's a new risk that was first recognized in Nigeria in 2017, 2018. Then it became a global outbreak, from the West African outbreak to the global outbreak. And now we're seeing it in East Africa. But we have different clades of this virus, but they all cause the same disease. They all cause a disease called MPOX, formerly known as monkeypox, which is characterized by the same features: fever, a very classic typical rash, and you can have lesions in the eyes, in the throat, and of course genital lesions were already recognized, but much more common when the virus is transmitted sexually.
So what's the current state of treatments and vaccines? Are they available?
Well, that depends which country we're talking about, which location. Vaccines are available. They have been approved by regulatory authorities in Europe, in North America. In Africa, Nigeria has also already approved one of the vaccines. The Democratic Republic of the Congo has now issued emergency authorization for 2 different types of MPOX vaccines. So the vaccines have only been available until now in countries around the world that were able to procure it themselves. Now we're putting in place mechanisms to support the responses in the African setting.
And in places like Europe, what is the prevalence of MPOX?
Europe, there continue to be outbreaks at a much lower level than in 22, 23. But the virus is still circulating in all regions of the world.
Can we talk about South Africa? Because there's been deaths in South Africa.
Mm-hmm.
So what's going on in South Africa at the moment? How widespread is the outbreak, and do they have enough treatments?
So the South African outbreak is part of the global outbreak. It's the same strain that has been circulating for 2 years. South Africa already had 5 cases in 2022. In the early days of the global outbreak, those were cases that were, in general, not too severe for most people, and they all recovered. Now, 2 years later, South Africa has now reported 22 cases to WHO. And of those 22 cases, these are laboratory confirmed cases. Already 3 persons have unfortunately passed away due to this infection. So whereas it can be less severe for most people, it can also be much more severe for people who have immune compromise, suppressed immune systems, which can be due to any number of factors, but the most common one is advanced HIV disease.
And is there any danger to women who are pregnant?
Yes, if a woman contracts MPOX during pregnancy, that can lead to severe illness as well, but also for the fetus. So there can be loss of the pregnancy, which is quite commonly described in that situation.
Well, as you know, we've come through, the pandemic with COVID-19. So is there an awareness that, of MPOX and its dangers? Are governments, heeding to the advice that the World Health Organization is giving? Are individuals heeding the advice?
Well, by and large, the global response was very rapid. And there were elements of the response which were absolutely critical, which is providing correct information to people about how this illness transmits, this infectious disease, and how people can protect themselves. So those who were most at risk during the global outbreak and up to now are those who have multiple sexual partners, who have encounters perhaps with people they don't already know, or in circumstances where there's less protection available. And so in those situations, people can be at risk. So the important messages were that we were engaging countries, were engaging health authorities at all levels, were engaging with affected communities. So working with communities who are familiar with, as you mentioned earlier, HIV response, learning how to reach people who are hard to reach by regular health services. Those are really important strategies, because when people have the information about how the disease transmits, they can also change their own behavior to reduce their risk and to mitigate that negative health impact on them. So that remains an absolutely critical part of the response, and South Africa is the same. So it's really important for the message to be out there that people who are at risk at the moment are men who have sex with men and who are perhaps at risk through high-risk activities. In addition, in South Africa, the HIV prevalence is high. And so people who are not on antiretroviral treatment are in fact at higher risk than would normally be the case. Because if their immune system is weakened by HIV infection, and then they have an infection such as the monkeypox virus, it can cause very severe disease. As we've seen in South Africa, of 22 cases, 2 have already died. 3 have died, actually. So that is really important that people get the information. And in order to make that possible, it's also very important to make sure that information is free of stigma. We can't be commenting, judging on people's social activities, on their behavior, on their sexual orientation or choices in that regard, because the virus will find whoever's vulnerable. And if we want to stop the outbreak, we need to engage with communities who are most affected, and we need to provide access to stigma-free healthcare. That is the most important. So people will feel that they can come forward for diagnostic testing, for advice, for information, and for care. And yes, South Africa is one of the few countries that has actually accessed a particular treatment called tecovirimat, which is an antiviral agent specifically for pox viruses. So most of the cases in South Africa so far have been able to have access to that specific medication. So we have every confidence that South Africa will be able to stop this outbreak. All the different measures are being put in place to do that. Health information, surveillance, contact tracing, working with affected communities, working towards introducing vaccination in the country, and offering appropriate treatment, medical care as is needed for each individual case.
Is the cost of care of the treatments a problem for some countries?
Well, yes, because the cost of the vaccines and the therapeutics are not cost-free. In fact, they're quite expensive. But at the moment, the World Health Organization is supporting South Africa to access those treatments free of charge.
And other countries, then South Africa in Africa?
Yes, the Democratic Republic of the Congo is also will be shortly accessing vaccines free of charge. These are emergency response mechanisms. It's not something that can be sustained necessarily for many years. But in order to stop an outbreak in an emergency setting, an emergency phase, WHO makes as much as possible these resources available or helps to coordinate access to them.
I've seen the word pandemic potential in some news reports. Is that alarmist, or does it have a pandemic potential?
Well, Linda, a lot of times these things come down to what do people mean by a particular word that they use, right? So in the COVID pandemic, virtually everyone on the planet was at risk, and people went to extreme lengths to reduce their risk. Again, it's about information. Having the right information to be able to reduce your own risk, whether that be mask wearing or avoiding crowded spaces, that kind of thing. For MPOX, it's gone to 117 countries. We have a database at WHO of 97,000 confirmed cases. That's not even counting the cases that never went for a laboratory test or the countries that don't report, because some countries have chosen not to report, which is unfortunate. So we know now from monitoring for 2 years and supporting the response in countries for 2 years that this is a virus that transmits through close interpersonal contact. It can be skin-to-skin contact, it can be sexual contact, it can be mother to child, it can be children to parents, children to each other, like any infectious disease of childhood, because it's a virus that transmits through close contact. So once we know those things, then we know what to look for and how to reduce our own risk of being exposed to that. But MPOX is not something that puts everyone at risk. At the moment, it is transmitting, for example, in South Africa, at the moment, it's transmitting sexually. So clearly, that's not. It has entered certain sexual networks, which at the moment are men who have sex with men. This is 90% of the cases so far. So our experience in the global outbreak is that the virus has remained in those networks. It has not really put very many people at risk outside of that, except, for example, in the household setting where you may have close contact with people in the household. That's quite different from what is happening in the Democratic Republic of the Congo. But the South African outbreak is part of the global outbreak. And so everything that you may have heard about the global outbreak over the last 2 years pretty much applies to South Africa. The difference is that in South Africa, the virus has found not only the sexual networks where it's transmitting, but also the most vulnerable who have advanced HIV disease and don't have access to antiretroviral therapy or didn't even know that they had HIV. So when you discover HIV by virtue of having MPOX, then you're already quite ill, or you have the risk of becoming quite ill. So that does not put everybody at risk, but it does mean that it's an infectious disease and people need to be aware of it.
Dr. Rosamund Lewis, thanks so much for speaking to us. That was so insightful. Thank you.
You're welcome.